have chosen the medical profession for ourselves, right? And we have chosen a branch, a field of lifelong learning, isn't it? Be it through our course and curriculum, which is very wide and vast. There is a whole lot of knowledge that we have to acquire. Then the NEET PG entrance examination. And then, of course, yes, while practicing as well, the process of learning continues, right? So now is a time, we've not asked this to ourselves as of yet. It is time that we ask this question, whether the learning tactics that we have been using, that is sheer persistence and slogging, those tactics, do they really work? Or are there more efficient and better ways of learning? Are there any neuroscience-backed up cognitive tools that help us to learn more efficiently, leading to more productive outcome and help us retain long term? So a scenario that we are very familiar with, we may have already been through that also in our lifetime so far. Now, Ravi studies 12 hours per day, fails the exam, does not perform that well, is lagging behind in scores, whatever way you may call it. And it's not like for him the hard work is, or he's not working hard. Okay, many times students feel that, just slogging in for hours and hours, day in and day out, that is the key. So it's not like the hard work is not there, that's not like the effort is not there. But hard work does not necessarily always means smart work, right? Now, the reason could be, one is poor habit, yes, of course. Apart from that, a very fancy term, and that is illusion of competence. Let's just, break it down. What is this illusion of competence, where we think that we know, right? Like, for example, the passive methods that we do while we are reading up a huge subject, while we're reading up clinical topics, we may be just, rereading through texts, right? We're thinking that we are revising, we're thinking that, we are reinforcing an idea, we're thinking that we're reinforcing a concept, but it's simply rereading. Or let's say, for example, highlighting a lot. Okay, I'm not saying that highlighting is absolutely non-essential or it's absolutely bogus. What I'm trying to tell you is highlighting too much. Or let's say cramming. We've all done our bit of cramming, the night before the exam. But frankly speaking, one may regurgitate or vomit it out the next day, in the exam, but then it's all gone. So these passive methods, they don't seem to work on a long-term basis, right? It does feel good. It can help us maybe the very next day when we want to regurgitate out all the contents, but it is, yes, going to lead to poor recall in our, let's say, for example, the NEET PG entrance examinations, where the course is wide, you have all these subjects that you have to master, right? So effort, all the time, effort does not necessarily equal to effectiveness. Right? So that is where the illusion of competence comes in. We think that we are ready. We think that we know, but we're not really, testing ourselves. So yes, we have been all throughout our lives, maybe, learning with a gut feeling, right? Learning intuitively. That's how we did. We followed our instincts, hit and trial. We tried to learn a particular way. It worked for us. It had been working for us for a long time. But yes, of course, when the undergrad days were there, or earlier, when the course material was less, it worked, right? So those old patterns are not going to suffice now. They're not going to be enough. So what does evidence tells us? Neuroscience-based evidence tells us that there are ways to practice retrieval of information. There are ways to space out those retrieval sessions, and focused attention is required during those spans of revision or retrieval practices that we are doing, and that is what is going to lead to a more stronger learning, a more effective learning. And I also give you a suggested reading list, right? This is very light reading. This is neuroscience backed up information, like from books like How We Learn, written by Benedict Carey, and Make It Stick, The Science of Successful Learning. I've gone through these books. They are light read, but they talk about such important principles and concepts that I'm going to outline here for you. But for those of you who are fond of reading, I suggest that you should read this once, right? Now, the step one is obviously we need to plan better. We want to plan daily and weekly. Now, obviously we have a broader sense of how we're going to prepare for exam. Subject weightage is there, which subjects ask it more often, which subjects have less weightage, and we will devote the time accordingly to these subjects. But apart from that, we need to plan daily and weekend. Why I say that? Because small wins, they beat long range blocks. I mean, you do set up a goal, yes, agreed, right? But you need to, let's say, set up doable and achievable small targets, because that gives a sense of completion. Right. Apart from that, it is always a good idea to make a night before to-do list. Like, for example, tomorrow what I'm going to study, because that will give you more clarity that you're already set for what you need to prep the next day. Now, this planning can also come with a sort of a fallacy. Sometimes we make mistakes. We do get an idea, a gist of something that we want to do, but we make mistakes. Like, there's a trap here. When we think that I'll finish, let's say 2 subjects, or let's say 3 subjects in this week, right? Now, the reality is that there will be distractions. There will be interruptions. The reality is that we many times, more times than less, underestimate the complexity of the task or the subject or the topic. I mean, we may be aware that a particular subject, a particular topic is my weak area. Otherwise, many times we do underestimate the complexity. And the solution is to break down big goal into tasks, like I told you, and to focus on one step at a time. So what we're trying to do here is go step by step, building blocks of information. So that is why we keep saying, don't forget the basics. Don't forget the basics. Start from your basic topics or your basic subjects, your first, your second, your foundation subjects, and then bring on the clinical information from the clinical topics. So step 2 is revision, right? Revision is the key. So if you're not planning to revise later a subject, a topic, right? If you're not going to leave space for revision for that particular thing that you read for the first time, it is better not reading it at all. Because something that is not going to be revised is not going to be remembered, right? The next question is, how much of the time should be devoted to this revision? Because yes, when you have a vast course, right, you will have to devote a significant portion of your time to first time reading, building of concept, revisiting the basics and everything, right? And especially this works when, you are planning for an exam which is going to be, let's say, 1 year down the line, right? So in the start of your preparation time, right, initially, right, you devote, let's say, 30% here, 30% of your study time to revision. But when you're gearing up in the last 3 months, at least you should be having 70 to 80% of time of your entire study schedule to be devoted to revision, and first time reading should be less and less, right? Now, moving on, what happens, let's say, when you don't revise at all what you read for the first time? What happens? What does neuroscience tells us, right? So you can see here, we have the retention in percentage, we have the time passes as days go by. So Hermann Ebbinghaus, right, he gave this forgetting curve, right? This is our brain's natural response. We read something, we experience something, and then we forget about it, right? Or we try to learn something and then we forget about it, right? Because our brain wants to keep, let's say, information that is essential to us, that is important to us, right? So brain is going to filter out anything that the brain feels that it doesn't need. So you have to reinforce. You have to reinforce what you want to remember long term. Like, for example, it is very easy to remember an OTP code, but then once you tell it to the taxi driver or anybody else, that OTP code is gone from your memory. It doesn't come back ever again, right? So that's our working memory. But we want to build on our long-term memory, so to say. So you can see this forgetting curve here, right? By day 3, we have forgotten almost everything. And let's see, 90%, we tend to forget more than 90% in just 24 hours or 1 day later. Now, yes, we're clear that we want to repeatedly read it, right? We want to revise it, let's say, right? So revising without strategy would be, let's say, for example, you tend to forget something, then you read it again, then you forget it, you read it again, you forget it, you read it again. And then again, you build on this illusion that I am doing this stuff, I am remembering again and again, I'm rereading. But with a vast course and with so many subjects to master, I mean, this frequency of repetition is something that you cannot achieve. It is unreasonable. right, to achieve this frequency of spaced repetition. So yes, there is revising with strategy, right? So revising with strategy is that you revise when the forgetting kicks in, right? And it has been shown, yes, neuroscience backed up, it has been shown that your first revision should be somewhere here, around third day, right? So obviously, you've read something today, you're going to revise it the very next day. It's obvious that you are going to remember most of it, let's say, right? But then, yes, on the third day around, you will tend to forget few of the things, right? And then you will, let's say, wire your brain, let's say, train your brain to actively recall more information. The effort that will be made to retract information, to retract, let's say, something that you had read, some concept that you had read, to fill in the blanks of your information, the effort that will be made actively by your brain is what helps in cementing memory, right? So you do it the third day, then you do it on the 7th to 8th day, somewhere around that time, and then you do it approximately a month later. Now you can work around it. But then yes, as first 2 repetitions are much more frequently done, but then you space it out. So that is what spaced repetition means. So how will it look like? How do we adapt to it, right? How do we use it? So we make a schedule and we stick to it, right? Like I said, plan daily, plan weekly as well. This is equally important. So let's say here you decided that you're going to devote some time to main reading or the first time reading, and then you have, given your time slots for revision as well. Okay, now whatever you read, right, you're going to revise it on the third day, then on the 7th day, let's say, it could be 7 to 8 to 9 days also, it doesn't matter like that. But then yes, you're going to space it out and then, revise it again on the 28th day, right? And as and when you increase your revision time, when you go into that part of your schedule or that part of your study phase where you are devoting more and more time to revision, you can also divide your revision into slots. Like you can give a 1 hour dedicated slot to previous year topics or like previous year questions, right? The frequently asked questions. You devote your time to those areas. You focus on those areas, right? You may have made your notes already. You may have made your flashcards, your flow charts, your diagrams, whatever. So you devote that time to that. And other than that, you may want to go for grand tests also. And you devote a dedicated time to give the grand tests, right? So you can, yes, make slots of revision as well. And as and when you're giving more time for your revision, what you can also do is mix the subjects instead of revising just one subject at a time. But then again, you can't overdo it also, right? Like you can't be taking 2 difficult subjects or 2 very large subjects and mix them together. You can, yes, maybe take related subjects, right? Like anatomy and surgery could be done together, medicine and patho can be done together. So related subjects can be taken together, or you could take a major subject and a minor subject together. So you can mix subjects. Now, why do I talk about this? Why do I say multi-subject mix, right? So you can have a massed practice like this where you finish off with one, wrap it up, close it, finish off with one, wrap it up, close it, and like that. And there's something that is neuroscience backed up, and that's said interleaved practice, right? Where you are taking, yes, subjects together, or you are taking different topics together, or maybe related topics. Like for example, if you are reading anemia from medicine, then you read anemia from patho also, you read about the iron metabolism and physiology as well around it, right? So you can, yes, you have to vary your whatever input that you're giving to your brain. Let's say you are dealing with the same topic from multiple areas. So that can be done, or yes, different subjects can be done together. So what is this interleaved practice and how does it help us? Look, see, when we, let's say, for example, see a particular patient, and the particular patient comes with a symptom complex, so and so symptoms, right? And then we have to decipher what is, we go from the differential diagnosis approach, try to find out what is the cause, and then we'll make a treatment plan, right? Now, we have to see the patient as a whole. It is not necessary that you have to think about different subjects. Then at the same time, you have to think the medicine of it, the pathology of it, the physiology of it, everything at the same time. Similarly, when you have real exam scenario, right, topic-wise questions don't come in the exam. Right? Subject-wide questions don't come in the exam, right? Your first question may be from anatomy, dealing with anatomy, or maybe the second question from pathology, third question from somewhere else, from clinical, right? So it's a mixed bag of questions. And if you're not training your brain to retrieve information in the way that it is going to be asked in the exam, right, then it's not going to work in the long run. So it is always a very good idea to mix subjects for stronger recall, avoid single subject binge, and interleaving in revisions also. So what is the wrong way to revise? Rereading notes 10 times, highlighting every line. It is just a waste of time and it builds false confidence. You may think it is working, and it is a huge bias, right? Like maybe we have gone through this, that we've done this bit and then realized it doesn't work also, because I realized it doesn't work. One has this habit of highlighting everything with different colors and then think that, yes, oh, I remember under that color this was written and this page would magically flash in front of my eyes before the examination. It doesn't happen, right? That happens sort of in a very blurry way. I mean, you will have an idea, okay, it was there somewhere, but then it's not coming with a lot of clarity, right? So rereading notes. See, revision is not rereading. Okay, revision means that you have to actively recall an information. I'll come to that in a bit. Let's just see here, highlighting every line, how that has made it all messy, right? Highlighting can work, let's say, for instance, in a situation where you have these, we have these huge textbooks, so we have this bundle of notes, right? And there in some passage, in some paragraph is a concept that I find is very relevant. Right? I find that it has a relevant clinical correlation. I find that there is a concept, there is a factual information maybe on which MCQ has been asked. Okay? Then I can, yes, mark it up for review. Right? And many times, you've seen students maybe doing this, like, mark it up and then, write down the concept as to what they understand of it in their own words also. Right? So that sort of highlighting, that sort of marking for review, that's another thing. Right? Or let's say, for example, one reason why students want to highlight is that, you highlight. This is my first reading. Second reading, I'll only read the highlighted things. Then I will highlight in a different color. Then the third reading, I will highlight in a third color. And by the fourth reading, I don't think one can make out what is important anymore there. Right? So that is why, long-termishly, when the course is vast and when, you have this time crunch, these practices don't work. So what is the right way to revise? The right way to revise would be active recall. So I've been using this term active recall time and again. What exactly does it mean? I've been saying train your brain. What does it mean? The best way is self-testing. Okay. The other best way is taking those quizzes, right? Quizzes or MCQs that you attempt, right? And the grand tests that you give. Those are the ways of active recall. Isn't it? Those are the ways that you are actually trying to retrieve information from your brain. Now, what sort of self-testing could look like? One thing that students tend to do is, they're sitting for revision, they've highlighted the text and they're just rereading it again. Okay, doesn't work. You've read something, right? You're sitting down for revision. You try to recall with your book closed. You try to recall what you had read, whatever information that you remember. If there's a flow chart you're trying to recall it, maybe note it down, try to work it up. And then there will be aspects and information that you have forgotten. Then you revisit it, right? So at least make that effort. Another thing I have noticed students do, and obviously I was a student once, so gone through and done it myself, been there and done that types. You read through a question, you don't know the answer to that question, okay? You don't even make the effort of working at it, and then you just jump to reading the explanation without making the effort of, trying to recall, trying to work it out. Because when you try to work it out and then you realize, oh, this is why it wasn't working. It's like, let's say, finding your way without a Google map. I mean, your generation, I think, has always had Google Maps around to find their way. But when we were used to do without the Google Maps, we would go to a particular destination. Let's say we're going to a friend's house and, we forget the address, and then we work around the ways, and then we do that a couple of times. And then we remember the address, we remember the way, right? So it's like that, trying to find the address. Now, making your own notes, flashcards is something that I always advocate. It's always been there. So there are, see, how many of us do really benefit from reading other people's notes, right? So be honest about it. So when you read something, you are closed book, then you recall, then you try to make your own notes, what you understood in your own language, right? That helps. That process helps. That process is definitely time consuming. I will not deny that. But that is the process that is actually helpful, right? Making your flashcards. So flashcards, what do we understand by that? You write a set of information, you write the answer to that, right? But then again, if you have a flashcard in front of you, which has the question and the answer there and everything written there, you're again not actively recalling. So you have a question. Behind that, you have the answer. You have a flowchart that has blanks of information also, which you need to fill at a later point in time, or you have MCQs, the good MCQs. What do I mean by good MCQs? I mean MCQs or questions sometimes that are making you think. Okay, so you have those set of questions that you have kept aside, that these I want to revisit later. So that is a proper way to revise, right? So with each revision, the content that you are going to revisit again and again is going to get more and more condensed, because when you're going in the final leg of your preparation, if everything is cluttered, you need to have very condensed revision packets with you. And you will have to make that first time effort of making those, right? And juggle and attempt questions, let's say 25 questions each of 3 or 4 subjects together, rather than doing 100 questions of one subject in a go, to give you that sense of practice of interleaving during revisions as well. So these are some of the things that we can incorporate. These are some of the cognitive tools that we can incorporate into our learning systems, right? Now, another system that I read about, very interesting, is the Leitner system, right? What happens here is there are certain, let's say, for example, flashcards that I have made, a certain bite-sized packets of information or flowcharts or diagrams or whatever it is, right, that I have made for myself to revise. And there are certain hard topics, certain medium topics, some easy topics, right? So hard ones I want to revise 3 times per week, medium I want to revise twice in a week, and easy topics I want to revisit, let's say, once in a week, right? And as I make progress, right, I need to revise less and less, because that is going now into my long-term memory, right? So how do we use this Leitner system? So we have, let's say, for example, whatever we answer correctly from that box, we have filled this box with our flowcharts, right? We answered correctly, we move to progress, and whatever we have answered incorrectly, we move back, that we want to revisit again and again, and in fact more frequently. So I'll give you an example like this. So session 1, yes, you pick out flashcards from box 1, what you answered correctly moves ahead. Session 2, you pick out cards from 2 boxes, what you answered correctly moved ahead, and what you did not answer correctly, let's say for example here, what you did not answer correctly moved to the first box that you need to revisit more often. So this way you can keep track of, revising at spaced intervals. This is a way that it is done. This technique is called as the Leitner's system. There are also, apps available, yes, that help you make use of it and track it. Now, in all of this, it is very important that we preserve our attention span, because yes, nobody can sit through, nobody can sit through long duration and hours of lecture and have the same focused attention throughout, right? So focus sessions of 45 to 60 minutes is what is advisable. right? And even if you sit for 60 minutes, even if you sit for 90 minutes, I mean, the most productive span would be the middle portion. Let's say, for example, the initial 15 minutes just settling in, and then focused attention, or 60 minutes, and then for the last bit of 15 minutes or 15-20 minutes, you're zoning out. And that's okay. And that happens to everybody. So make use of this, right? Make use of focused sessions of short durations. Take short breaks in between, right? After a couple of breaks, you can also take breaks for, naps in between, which works very well. And this is what we call as the Pomodoro timer, right? The Pomodoro technique, which, times your, small session durations. Other than that, yes, of course, we need to kill those distractions aside. I mean, nothing is gained by being on the phone for a longer duration of time. So put your phone outside the room, because there's a tendency that you will, maybe silent it, and then you will put it face upside down, but then you'll have this nagging sensation of maybe turning it over, flipping it over, and seeing if any notifications are there as of yet. So if you have it in front of you, definitely you'll go and grab it, right? So put your phone outside the room, turn off the notifications. Study at a designated desk, right? Make your study space, clean it up, organize it, So when you organize your study space, it's something like, you kind of organize your thoughts as well. And that is true. I mean, you can always try and do it. Now, there's also something very interesting that I came to read about, is this Bloom's taxonomy, right? This is something that educators use as training tools. And this is important for us also, because I always feel that the best way to learn is to teach, right? So again, yes, while learning for myself also, I try to keep these principles in mind. Because see, there are certain things that we remember. We have to remember that, right? Those facts, those informations, right? Those building blocks, which we did in our first year, second year subjects, right? You understand them, not just remember them, but understand them. There are related bits of information, right? Different systems in our body are related. One thing leads to the other. You understand them. Then you apply that knowledge. You apply that knowledge into attempting, let's say, MCQs, into attempting, questions and MCQs, and now, even for example, your theory exams, or for that matter, right? And more importantly, practical application into real life clinical scenarios, right? So when you're applying that information, you have to analyze different aspects. You have to analyze, because we're working in a situation where we'll start with the symptom complex and then work out the differential diagnosis. So you have to analyze, evaluate, and then be able to, let's say, for example, create a treatment plan, for example. Right? So this is what we say, the grades of acquiring knowledge, where as you step up, you build up the blocks. As you step up, you go from simpler levels of understanding, simpler level of learning, to more complex levels of learning, where higher order learning or more complex levels of learning requires you to compare different concepts. Compare, contrast, and learn. I'll give you an example. Let's say, for example, a woman comes with the complaint of abnormal uterine bleeding, right? Now, remember, you need to remember that she is maybe a reproductive age group woman, and she could be pregnant, maybe, and that is the reason for her abnormal uterine bleeding pattern. Or maybe she's not pregnant, and there could be a number of causes for that. So you need to remember the possible causes, right? So yes, there is some remembering that you have to do. So the possible causes, we talk about the Palm-Cohen approach. I just give you an example, so I won't be detailing this, right? So it could be because of polyps, the common conditions, adenomyosis, fibroid, leiomyoma, malignancy, right? I'll just write for O here, ovulatory dysfunction, just to give you an example. So this you remember. Now, what do you need to understand here? You need to understand that, yes, these are the list of possible causes. You have made separate chunks of information already in your brain. You've read about it. You've read about polyps separately. You've read about adenomyosis in a separate chapter. You've read about leiomyoma in a separate chapter. You've read about malignancies in a separate chapter. But what you get in clinical practice, what you get in your exams is a symptom complex. You get a symptom complex. And this is the entire process of reasoning and differential diagnosis approach, right? So you know the symptoms of these. You know that there are overlapping symptoms. You know that there are contrasting symptoms, right? So you have to start with a history. You have to go for an examination. You know there will be similarities in examination. You know there may be something striking differences in examination. So yes, fibroids and adenomyosis are differential diagnosis of each other. Very important differential diagnosis of each other. So you compare how are they different from each other. How do they behave similarly to each other. You compare and learn and try to retain long term. Now you understand that these are the structural causes, meaning you may be able to see them on scan. You may be able to have a histopath report, right? So you know that you will start with an ultrasound. So this is how you apply your understanding, right? This is application. You know that an initial investigation of choice or initial ultrasound will help you streamline your causes. Right? You know that it is important to look at the cervix because as far as malignancy is concerned, it could be a cervical cancer. So you know the importance of completing the examination. You know that malignancy is going to be eventually a histopath diagnosis, right? A confirmatory histopath diagnosis. So you know that for endometrial cancer detection, you'll have to go for endometrial aspiration and histopath. For hyperplasia diagnosis, you'll have to go for a histopath. So now you understand that women at high risk for endometrial cancer, at high risk for endometrial hyperplasia, deserve an endometrial aspiration before being subjected to any treatment. Maybe there is a small fibroid, some evidence of adenomyosis sitting there. But if she is high risk for endometrial cancer, endometrial hyperplasia, age being more than 40 is very, very important and different characteristics. So one thing leads to the other. So you analyze what needs to be done. You analyze, is she high-risk woman? Does she deserve an endometrial aspiration or a simple ultrasound is enough? You analyze, you evaluate the case as a whole. You evaluate based on the history, based on the examination, based on your initial investigations. You evaluate as to what is your most probable diagnosis and then what do you need to do to confirm it. And then you go ahead and do that. And then you create a treatment plan. And this works for any scenario. The only thing that you have to understand is that there are things that you need to remember, then you need to apply that knowledge. And this is how practice it. Make your own flowcharts. Think about it. Why are we doing a particular investigation? Right? Why is it a particular diagnosis, not the other? And that is how you train your brain in this process of arriving at a differential diagnosis. You train your brain into responding and picking out keywords while you're reading a question. You don't mug up those keywords. You pick them out. Okay, you read a text, you read the stem of the question and those keywords make sense to you because your brain actively recalled those keywords, had actively recalled those keywords earlier as well. And if you sit in your exam without that kind of practice, it doesn't work. Or maybe it works, but then maybe you have your own way of working around it, but it will become more time consuming. Right? So let's have a quick recap of these key tools. The key tools that I talked about is first of all daily and weekly planning. Revision is your memory glue. If you are not going to revise a topic ever again, it is equivalent to not reading it at all. Right? Active recall, spaced practice, spaced repetition and interleaving. These are Very fancy words, but then yes, what they mean is I've told you how you can incorporate them in your learning schedules, and protect your attention span. That is very important. Contrast learning, compare concepts, right? That will work with all your clinical subjects, right? And don't compromise on sleep, because see, all of us do have our own peak times of performance. Okay, there's certain times in the day when we are very productive, right? For somebody it could be early in the morning, for somebody it could be late at night, for somebody it could be in the afternoon, which I doubt people after lunch have that productive capacity. But then nonetheless, we all have our own productive times. Make use of those productive times, right? Do the hard bit of working in those productive few hours, right? And then take the required amount of rest and sleep so that you wake up refreshed. Especially if you've ever tried it, because I have done it and I've read about it, that it works, that whatever you read in the day, if just once at night before sleeping, you kind of just recap it. Nobody's asking to just sit with your pen and paper, but yes, just kind of recap what you had gone through in the day, and then you sleep over it. Sleeping cements memory, as simple as that. Okay, like for example, you can have those days of learning where you feel that, oh, it is working, you're really gaining a lot, but then you're not getting enough sleep. Okay, so it is good when you have to cram up a day before the exam and then vomit it out, then it works. But when there is something that you have read months ago and then you need to retrieve that information on the day of the exam, when you have a year of preparation condensed into a couple of months of revision and then a couple of hours of examination, then these sort of tactics, these old habits, they are counterproductive, right? So remember, do not compromise on your sleep. And my closing remarks would be, work smart, okay, and slogging for hours. And if you're not getting the required results, maybe your effort and your dedication is not the problem. Maybe your strategy is the problem. So use neuroscience, rework your strategy, try something. If it is not working, always readjust your strategy according to what works for you. Because learning eventually, yes, is a step-by-step process. It is an effortful process. The first time reading is so important. It is going to be an effortful journey. There is no shortcut here when you want to retain things long term, when you want to become a good clinician, right? Remember that learning is an effortful process. At the end of the day, when you do see your seniors and your consultants being so effortless in their differential diagnosis, being that effortless has required a lot of amount of effort to begin with. Thank you so much.